Adriana Lanting and Jeff Pritchard from Rotarian Malaria Partners. Rotarian Malaria Partners is a group of Rotarians and leaders of non-government organizations who are committed to working to facilitate a broad international Rotarian campaign for the global elimination of malaria. They believe that malaria can be combated through a comprehensive Rotary campaign, similar to the Polio Plus campaign, by working with Rotarian groups around the world. They advocate within Rotary to gain broad international support from districts and clubs and for the support of the Rotary Foundation. Thank you for joining us.
Thank you. Thank you for having me. Thank you, Chip, and thank you, Scott. Thank you so much for having me here today. The last time I saw Scott was in Long Beach when we had the coldest day of the year, where he could enjoy a boat ride at the large club conference, and I got to meet Scott and Chip there. Thank you, and it's good to see you again. In the respect for time, we'll get going here. What I'm going to do here is talk to you about malaria, explain what it is, talk about a little bit about how Rotary's got a pretty unique position and how you and I can make a difference. So here we go. Malaria has been with us a long time. Just like in the movie Jurassic Park, universities drilled through amber into fossilized mosquitoes to see what's in their blood. Among the things that they found was malaria, going back over 30 million years. And this is why scientists believe malaria has been the greatest killer of humankind throughout the ages. So let's add some perspective. So far this year, as of late July, affected by the global pandemic, more than 400,000 people have died of COVID-19, and that's in the world. Last year alone, more than 450,000 people died due to malaria, and 90% of them that is in the low-income regions of Africa, mostly children under the age of 5. So estimates are about 750 children per day. Here we're closing schools and we're not going anywhere, and we're really trying to fight this COVID-19. But this is something that in some of the areas in Africa that they deal with every day. So let's try to understand a little bit about malaria. So if you look on the bottom of the screen there, it starts when a mosquito bites an infected person. This is a pretty cyclical disease. So a mosquito bites somebody that has malaria, and the victim's blood is now in the mosquito's spit, or in the mosquito. And a week later, when it's time for the mosquito to have another blood meal, it bites the next person. And because that parasite is in the mosquito's saliva, it transfers to the next person. It goes into that person's liver, takes about 10 to 14 days, and then it jumps into the bloodstream and starts to affect the red blood cells, essentially latching on to them and sucking out the inside, killing the red blood cells, and then moving on to the next one. Since the red blood cells are the ones that carry the oxygen, the person that has malaria is usually exhausted and sweating and spending like 2 weeks in bed, even if it's not fatal. So right now we're looking at about 250 million cases a year. This is a picture of a graveyard in Uganda. Now, I'm sure many of us have been to a cemetery, and we always stop by and we see, we read some of the plaques and stuff. And for me, I know that when I see one where it's been a child, I think, oh, gosh, such a short life. But unfortunately, when you visit a graveyard in some areas in Africa, those little children's grave sites really outnumber the adults. Let's see here. So the ancillary effects of malaria. This is a picture of a clinic in Uganda, and 70% of the caseload combines with these people that think they have, or they think they have malaria, especially during the rainy season. And ironically, the people that are really out in the rural areas don't go to these clinics. I mean, imagine yourself in Africa. You're going to walk down 5 miles of dirt road, and there's probably lions and tigers hiding behind the bushes, and you don't feel well. And are you going to go walk to a clinic to sit in this and decide, and so they can tell you if you have malaria? So it's really a tough road. Rotary is leading a fight to eliminate malaria. I think my slides may have gotten mixed up here. Hold on a second. Okay, so Rotary is leading the fight, trying to lead the fight here to eliminate malaria. We're working with in-country chapters in Uganda, in Zambia, Gambia, and aside from the invitation that we received at the Large Club Conference from the Gates Foundation to join them in their fight, they've offered to match us 2 to 1. So we're working with them. We're working with UNICEF. We're working with, as you can see, a lot of partners, and they're coming to us now because of the work that we're doing. There's 4 main reasons that that I think that they want to work with Rotary. First of all, we've built a giant structure with polio, with our immunization campaigns and surveillance. In last year, in the polio commitment alone, Rotarians have given $1.9 billion since 1985, and that doesn't even count what we've given for water and education and things like that. Third reason is that we're politically neutral. In our last visit to Zambia, there's a picture of Jeff Pritchard there talking to the vice president of Zambia, and there's a picture of on the right, there's a picture of Jim Moore, who was our vice chair, who also made a visit to Africa, and we're welcomed with open arms by many of the governments. And lastly, of course, it's our boots on the ground. We've got clubs that consist of the leaders, the doctors, the lawyers, even people in the military that belong to Rotary. And of course, that puts us in a great position. Some of the projects that we've done. This is Zambia. I was lucky enough to visit Zambia in October and see some of the projects that we've done. Some of the projects that we've done include bed nets, spraying, drug administration, but the big one that we're working on is community health workers. I was fortunate to go out with these community health workers. This picture of me when I went to Zambia with these community health workers out into the field. And what they do is they do a test for malaria. They have medications where they can actually treat on the spot. So these people don't have to walk all those miles to get there. So here we are doing a test on a little baby. You can see is really happy about this. What they do is they take a drop of blood and they put it on this thing, which is a rapid detection thing, and you wait about 20 minutes and it will show like a bright red if the person has malaria. Obviously, this person does not. Then they take and they record all of their tests, their positive tests, so it can be entered into a main data system later, and they can see where the vectors are and where they really need to work, where malaria is getting really prevalent. This is a typical office. They show up and they've got their tools and they're ready to go. And these are community health workers that have been trained by Rotarians, by Rotary, by a project that we've done with Rotary. So here this is a graduation class. When they graduate, they get bikes, and that's how they get out there into the field to take care of these people. And if they find somebody that is, has gone pretty far with malaria, it's beyond where they can treat, they can make arrangements to take that person to the hospital. I've got to take a picture with a couple of the happy graduates, and there's the graduating class. It was really exciting. They are so excited and so motivated to go out into their communities. As the dispersion of COVID-19 transmission increases, the situation in most of the rural areas is going to become really more critical, as you might imagine. And as expected, the impact of the COVID-19 pandemic on malaria situation is a reduction in detection and treatment and underreporting of malaria cases. Barriers to early diagnosis are the main determinants. Although there was an overall reduction of malaria cases before the introduction of COVID-19, it's predicted that malaria deaths will double in 2020. So modeling shows an increase that will exceed 700,000 this year alone. So let's think of that, 700,000, and 90% of those are kids, and doubling. So it's going to be about 1,800 kids are dying per day. And the sad thing is that malaria is a disease that's detectable and treatable, and that's where we come in. This is just a little graph showing what I just explained, and how can we make a difference? Obviously, we can advocate, we can learn, we can join our RMP newsletter. You can go to an RMP webinar, which we've had some really great webinars lately. We've had the Gates Foundation, the World Fund, the Global Fund, or you can participate in a grant. Right now we're working on a grant in Copperbelt 2, which is in Zambia. And we've been fortunate enough to have this group of clubs work with us, and of course we would love to have you. This is how we're really excited about this. It's a 1-to-5 match. So your $5,000 will educate and equip 25 community health workers. And then they will in turn go out and test and help over 12,000 people. So I'm not a great mathematician, but I can figure out that that's about $2.50 a person. Geez, what a deal. So in conclusion, I'd like to say that malaria is going to end with me, but I'm going to challenge you or ask you or to take out your telephone right now and point it there at that QR code that I have. And that will connect you to our website, where you can scroll down and you can sign up for our newsletter. And that will keep you informed of what's going on with malaria, how you can help, and maybe you would like to join one of our webinars. They're really pretty great. We have one coming up in next month. And especially because this is the beginning of the week of Mosquito Day, when we're all mosquito fans, I would really be grateful if you would sign up and log on and ask me any questions you have. So how's that? Thank you very much for letting me present. I'm going to leave this up here so you have time to get your phone out and get that code in. So are there any questions?
Yeah, I have a question. My name is Mimi. I'm from Oromia, part of Ethiopia. Are you guys working only in Uganda or some other African continents as well?
We are working in other countries. We're working in Gambia, Uganda, Zambia. We've got plans, things going on in Mozambique. And a member of our board, Ezra Tesroni, from Ethiopia, and he is moving forward with things that we can do there. And if you'd like to start something, we'd love to have you come on board.
I have a nonprofit organization that I created with my friends and family, empowering women in rural area. So, yeah, by giving milking cow to the very poor families. And we have to take malaria pill every year when we travel, and children are dying, of course, by malaria, and family are suffering. I would like to know more about it, just to minimize the issue that's going on in that area as well.
You know what, Mimi? I will, if you would like to, or you know what, I will reach out to you. In fact, I'll reach out to Scott and check your email. And if you would like, anybody in the club would like to reach out to us, Rotary Malaria Partners, I will give you my email and send me something that says, yeah, count me in, and I will, and I'll reach out to you. And Mimi, definitely I will send an email to you. Also, again, you can look on that little QR code, or our website's right below, and you can reach out to us that way. But Mimi, I've got your name now, so I will be calling you.
Awesome, thank you.
Thank you.
I have a question. Is malaria a problem in any parts of the United States?
Well, you know, it used to be, and as you might imagine, it would be more of like in the Florida area. But the United States is very fortunate in that we're a very wealthy country. And so we were able to handle that, you know, at the beginning, when we started to have the spray and all that, we can afford it. So we've pretty much eliminated malaria here in the States, and that's great for us. But the unfortunate thing is that we don't pay attention to it for everybody else. So yes, we have had it here in the States.
I have a question.
Yes.
So does it take a sustained infrastructure in each country, or is your organization more mobile that travels from hotspot to hotspot?
Well, actually, that's a good question, because sustainability is something that we talk about a lot. And we don't really move from hotspot to hotspot. We work in conjunction with the government. For example, you saw that picture of our board chair, Jeff, speaking with the Vice President of Zambia. There are 15 countries in Africa that have come together to define how they were going to work to try and eliminate malaria. And, you know, part of that is, of course, the government support works with our sustainability. And then, of course, you've got to make sure that they've got the money. So they've got long-term givers are involved, like the Rockefeller Foundation and the Bill and Melinda Gates Foundation. So we're not out there by ourselves just trying to get one mosquito. We're out there working in a network. So hopefully it will be more effective. Did I answer your question?
Yes, you did. Thank you.
Okay. Thanks for asking.
Is the World Health Organization involved?
Yes, the World Health Organization is definitely involved. In fact, the director of the Africa region for the World Health Organization will be featured on our webinar in October. They are very involved. Well, if that's it, thank you very much. And I look forward to talking to some of you again, or all of you again. And Scott, I look forward to seeing you again. And thank you for having me. Thank you for the treasure of your time.
Next week, our program will feature a program on the railroad, CSX Transportation, courtesy of Ken Ackerman. Last thing, the reminder, I dare you to reach out to someone on the call today. Have a great week. We are adjourned.